Hello, and welcome to another episode of Ask Kate with me, your host, and brought to you by the Children's Tumor Foundation. Today I'm going to be talking about a question that came to me in an email this week, but it's certainly one that I've gotten before and comes up pretty frequently. And that's the idea that often when you're living with NF, you have several specialists that you see, or maybe just one. Maybe you see a neurologist, or maybe you go to an NF center, and often those appointments only happen once a year. For a lot of people living with NF, there isn't a need to be seen by their NF specialist or in the NF center more than every year, or maybe every 6 months at the most, and that's just for the regular check-in with their specialist. But you might be seeing a primary care doctor more often than that, because despite the fact that you have NF, you also just have things that happen. You can get a cold, right? You can get the flu. And so a lot of people will go and see their primary care doctor with a symptom of some kind and leave a little frustrated in feeling like maybe their doctor doesn't understand that not every problem is because of NF, that not everything that happens to you can be attributed to or blamed on NF, and maybe doesn't have the ability to discern that difference of when this is something that we need to look into a little more because perhaps this is being influenced by the NF, or no, it's not. This is just, we have the flu kind of a situation. So in that scenario, I see a lot of patients who are frustrated, trying to find a great primary care doctor, trying to figure out the best way to get routine, regular care. So this question came from an adult, but I think this applies both to adults with NF as well as to parents who are caring for children with NF, thinking of family practice doctors or pediatricians, internists. And so the answer to the question that this particular person asked was whether we at CTF have a list of primary care doctors who are particularly interested or invested in NF. And the answer to that, unfortunately, is no, we do not. I think that list would be very difficult to manage because of just the sheer number of doctors in this country. However, I do have a couple of suggestions for how to improve your working relationship with your primary care doctor. So first of all, what I've said several times to lots of different patients, when it comes to any relationship with a medical professional, it's really important that you feel that you can trust them. Trust is generally built when you feel like you're being heard and listened to, when you're being taken seriously and considered as part of your own medical care team and a valued member of that. So that's the first thing that I say. If you are seeing a physician and you feel they aren't listening to you, they aren't taking your concerns seriously, that's a real red flag, and it might just mean that it's not the right fit for you. It could be something as simple as personalities that just don't click, and so I would definitely suggest considering your options and looking to see if you can make a change. The other thing you can do, honestly, is to just be open and honest with your physician. I think sometimes it's easy as a patient to forget that they're human and that it's possible that you are the first person with NF that they've seen in their clinic ever or in years. Despite the fact that we as people who are involved in the NF community understand that this condition is not that rare and affects, like we always say, 1 in 3,000 people, for a primary care physician, despite the fact that it is relatively common, they still might not be seeing it in their clinic. And so as they're seeing you and trying to provide care for you, there could be a little bit of fear for them. They could be feeling nervous that they aren't exactly sure how to approach things. It might seem easier to them to keep referring you back to that neurologist or your NF specialist of some kind, even if maybe this is something that they could address in their clinic. So just kind of keeping that in mind and being open to offering them education. CTF has a lot of great resources for that are really excellent for physicians. And I would say that that's also an important key to building trust with your provider, is their willingness to educate themselves. Physicians have to know about so many different disorders, and so their ability and their willingness to say, I can learn something new, I'm entirely capable and willing to do it, is very important. And so offering them those resources, they can reach out to the Children's Tumor Foundation. I talk to doctors all the time who are looking for just some more information or support for their care for their patients. That is absolutely something that you can suggest to them. There are also excellent articles available to them. These are things that I can send to you that you can actually find with a good Google search yourself, but I'm always happy to help. And so there is a great article for the care of the adult with NF1. There's an excellent article for the children with NF1. And these articles really do focus on trying to support a primary care doctor in their care of these patients. So basically, I think the important thing to remember is that your doctor is human and that they might need to learn with you and learn from you. And while I know that that can be exhausting and overwhelming at times, as I've said before, you are certainly your best advocate. And so we are here to support you in doing that. And so if you need any of those resources, if you need support in finding some of those articles and learning a little bit more about how to talk to your physician, please reach out to me. I'm always happy to offer advice and support in that regard. It's something that we care a lot about here at CTF and that we want to really see improved care for NF patients around the world. So as always, my information is down there, and I love hearing from you guys. I've gotten some great comments in the last few weeks, and I would love to see those keep going. I love seeing you talk to each other in the comments. I think it's really fantastic. So keep it up and keep watching, and I'll see you next time.